Today we've got a question, Comlex Level 1 style question, USMLE Step 1. Go ahead and pause the video now, read through it, pick an answer, and then unpause when you're ready to talk about it. Okay, so first thing I always do whenever I'm approaching a question is I look at the question part first. So that's usually the last sentence. And that is here. What's the most likely physiological change responsible for this newborn's heart murmur? Okay, so that gives us a lot of info. We have a newborn with a heart murmur. We just don't know what yet. Maybe it's a bit of an advanced technique is to look at the sentence prior to the last one too. If you see something like this where it's you have a feeling that you don't necessarily need to read the entire vignette, you can just look at the previous sentence, and sometimes the answer is there, and it really is continuous machinery like murmur. So we already know what the murmur is based off of that, based off our outside knowledge as well. So we don't even have to read the rest of the vignette with that in mind. And normally what I would do is I would start with the last sentence, then jump into the answer choices. Here, I do a little bit of an advanced technique that's looking at the previous sentence to get the murmur. So I really don't even need to read the answer choices just yet because I have everything I need in this last two sentences. So continuous machinery like murmur, that's a buzzword. If this is not in your Anki, and you didn't know it, you should absolutely put it in there because you need to know this. Continuous machine-like murmur is a patent ductus arteriosus every single time. Okay, so again, our continuous machine-like murmur, PDA, every time, put that in your Anki so you never forget it. Now, let's just go ahead and read through the answer choices to see what we've got. So resistance increases, systemic circulation, pressure decreases in the left atrium. Okay, so it's a lot of either pressure changes or resistance changes. So now we should be thinking, without like really thoroughly reading them, we should be thinking about what do we know about PDA? How does it affect our physiology? So let's go through here and draw it out. And it's going to be like a 12-minute drawing montage for you, Aubrey. I quit smoking. Don't leave that in. Oh, maybe do. I don't know. Take it. This is why I didn't go to art school. So I went to art school and we drew out here, at least I tried to draw out here, the pulmonary trunk with the right and left pulmonary arteries. We've got the absolutely awful looking aorta kind of going through the back. That's what these dashed lines are. It's going through the back. If you can hallucinate with me, as the osteopaths say. We have our aorta, and then this is our ductus arteriosus here. These are some of the branches off the aorta. It's not a hairy aorta. These are the branches, I swear. So in our fetal circulation, and I'm going to use a different color for this, if I can figure out how to do that. Perfect. Love it. We're going to use blue for blood. That's the first thing I think of when I think of blood. Yeah, oxygenated. Sure, why not? Fetal circulation, you're going to have some flow coming up through the pulmonary trunk, and it's not going to go into the lungs because the lungs are essentially collapsed in utero. There's no need for lungs. We have the placenta supplying oxygen from the mom's circulation. The lungs aren't developed yet, so there's no surfactant. They're closed, essentially like an atelectasis, if you will. So they're all closed off. There's high pressure in the lungs because they're closed off. So very high pressure. Remember, fluid likes to move from high to low pressure. Your blood is not going to move towards the lungs. Instead, it's going to go straight up through the ductus arteriosus and join the flow that was already moving through the aorta from the left side of the heart. So they meet up and you get this extra flow into the systemic circulation, bypassing the lungs. So what happens after birth? Well, the lungs have expanded. They're surfactant. They're mature lungs. So the lungs are open. There's less pressure in the lungs. So now blood should start moving towards the lungs. And eventually this ductus arteriosus it's called obliteration. When it becomes a ligament, it becomes the ligamentum arteriosum. Sure. And eventually there'll be no flow through here at all. But until that happens, and sometimes it doesn't happen, what'll happen from the aorta, we'll use a different color for this, lovely yellow, is we'll have blood or oxygenated blood coming up from the aorta. And now it sees a new path of least resistance, and it'll backflow, come straight back down and go into the lungs again. So you might have blood that was already oxygenated through the lungs, come right back and go through the lungs again. So we're decreasing our flow through the aorta. And there's a couple reasons this happens. Like I said, the lungs have less pressure. Okay, so I made this awesome table to show you before birth, after birth, and then we've got our lung vascular resistance and our systemic vascular resistance. So like we said before birth, our lung vascular resistance is very high. And our systemic vascular resistance is relatively low. So our net flow is from the pulmonary trunk to the aorta. After birth, what's normally supposed to happen is we get this reversal. So our lung vascular resistance decreases, whereas our systemic vascular resistance increases. You can see how you kind of get this left to right shunt that happens through a patent ductus arteriosus after birth. Okay, so that's all we need to answer this question. So let's go back to the answer choices and take a look to see if there's anything that aligns with what we said. So resistance, oh, hang on. Let me reread the question because it's been so long with me trying to draw that. I totally forgot what the question was. Most likely change responsible for the heart murmur. A, resistance increases in the systemic circulation. Okay, we did just say that, so it's probably that one, but let's keep going, read through. Pressure decreases in the left atrium. So when the lungs are opening up, especially with a PDA where you're going to have extra flow moving through the lungs, your pressure would actually increase in the left atrium. So it's definitely not this one. Resistance increases in the pulmonary circulation. Nope, not after birth. It's the opposite. Pressure increases in the right atrium. No, I don't really think that has anything to do with it. If anything, pressure would decrease in the right atrium as we are decreasing our venous return because we're decreasing the amount of blood in our systemic circulation. So we could cross that off. Pressure increases in the pulmonary arteries. That is true because now we're having this left to right flow like we said before. So technically, yes, we are going to have more pressure in the pulmonary arteries, but that's not what it's causing the murmur. What's causing the murmur is decreased resistance in the lungs, allowing for backflow, and increased resistance in the systemic vasculature, allowing for backflow. And the only one of those we have here would be A. Even though E is correct, it's not explaining why the murmur happens in the first place.